If you are worried you have Lyme disease, or just like the outdoors, and want the peace of mind of knowing whether you have Lyme disease or not, there is a new Lyme screening test based on decades of research by Dr. Richard Marconi, a professor at VCU Medical Center. For more information, visit glymedx.com, that's glymedx.com, or email at info@glymedx.com.
Infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Hi, everybody. This is Robert Harriman, and you're listening to Outbreak News Interviews. And I appreciate you listening today, and I encourage you also to check out the website, OutbreakNewsToday.com. Now, an anti-vaccine sentiment is alive and well here in the U.S. and also abroad. This is not a new phenomenon, although, but we've seen a resurgence of it in the past 20-odd years. So what are the arguments? Who's the cast of characters? And how can becoming more active in promoting vaccination to friends, family, and the public at large, how does that work? Well, joining me now is Tara Smith, PhD. Dr. Smith is an associate professor at the Kent State University College of Public Health and the author of a recently published paper in Open Forum Infectious Diseases entitled Vaccine Rejection and Hesitancy, a Review and Call to Action. Dr. Smith, welcome to the show.
Thank you for having me on.
You bet. All right, before we get into some of the details, sum it up. What's the overarching message you wanted to convey in this paper?
Right. I think it's really that scientists have a responsibility to talk about vaccines more openly, to have some of these difficult conversations with loved ones, with friends, with people they meet on the playground, and to really advocate for vaccines, to discuss the pros and cons of them, and even maybe reach out to legislators who are thinking about changing laws on vaccines. So I think we just need to be more active in promoting them more generally.
Yeah. Now, so where did this anti-vaccine sentiment come from? I mean, it's got a long history, and how pervasive is it really today?
Right. It's not that pervasive. Most people, by and large, still vaccinate their children, vaccinate themselves. But it is definitely a very vocal minority of parents and of individuals in society who are against vaccination or fearful of vaccination. It's as you mentioned, it has a long and storied history. It dates back even prior to official vaccines, even when people were using variolation for smallpox. Mm-hmm. There was definitely resistance to that. There were editorials, political cartoons suggesting that, once smallpox vaccines were released, that this would turn people into cattle and things like that. So it's as old as vaccination itself.
Many of the arguments against vaccines are the same that have been rehashed over time, despite some pretty strong evidence against it. What are these main arguments against vaccination, and how do they have an effect on people's thinking?
Right. So, of course, the big one is just that vaccines have never been proven to be safe, or that we're giving too many of them too soon, that children's immune systems are unable to take that many vaccines at one time. A number of ones that are more specific to particular vaccines, such as some of the ingredients in them, some of the preservatives may be unsafe. And, of course, now that the suggestion that they cause autism or other type of neurological issues. So these have been, again, rehashed over the years. If you look back in the 1900s, they had very similar things that, vaccines were unsafe, that they were creating problems in our children. None of this has ever been proven. And we've had study after study looking at these issues, looking at vaccine safety. They're one of the most tested pharmaceutical products, ever. And these concerns about vaccines keep coming up despite study after study showing that, vaccinated children have no difference in health outcomes besides being protected from these infectious diseases than, unvaccinated children, that vaccines just don't cause the harm that some of these people fear and suggest that they do.
Okay, let me get in a word from our sponsor. Now, for many years, we have been waiting for a Lyme disease test that actually works. After decades of research by Dr. Richard Marconi, a professor at the Medical Center at Virginia Commonwealth University, a breakthrough test has been developed. The GLD test, recently launched by Global Lyme Diagnostics, is based on Dr. Marconi's science. For more information, visit glymedx.com. That's glymedx.com, or email them at info@glymedx.com. Okay, now in your paper you list the cast of characters, and this cast of characters has been pushing the spread of vaccine misinformation for some time, and the list is pretty lengthy. Who are the major players, and how effective are they?
Right. So the one that most people would probably have heard of is Jenny McCarthy. So, of course, she's an actress, she's a comedian, she's a model, she's a writer, and she believes that vaccines caused autism in her son, Evan, who she later claims has been kind of cured from that. So she is a very vocal advocate against vaccines, as was her former partner, Jim Carrey, who kind of worked with her while he was, while they were dating. So she still is very much in that realm. She has stepped back, I think, a little bit with her new TV show with her new husband, Donnie Wahlberg. Mm-hmm. But she still writes op-eds. She still makes appearances at kind of anti-vaccine conferences. So she's probably the one that is most known to most people. But one thing she lacks is any kind of scientific credibility. She's not a biologist. She's not a doctor. But some of the anti-vaccine advocates are. So one of the other prominent ones is a former physician named Andrew Wakefield, and he's a British physician who was one of the ones who really put forth the idea that vaccines, and specifically the measles, mumps, rubella vaccine, are a cause of autism. So he published this in a paper in the late 90s based on a study of about 12 children, suggesting that they had got the MMR vaccine and then kind of regressed into autism. That paper was later found out to actually be fraudulent. He got payments from a lawyer to do it, and his medical license was revoked in Britain. So he moved to the United States, and he now lives in Texas. And really, kind of this whole anti-vaccine thing has become the main thing that he's doing right now, since he can't practice medicine. So he's had a recent movie out called Vaxxed, that is a kind of a very emotional appeal against vaccines, putting together a lot of these kind of anti-vaccine arguments and bringing in parents that think their children were vaccine injured. So that movie has kind of made the rounds in the United States and elsewhere. So he's one of the big ones kind of right now that is featured in a lot of different things. And there are other physicians as well. Many parents have read the Vaccine book by Dr. Bob Sears, where he suggests this alternative vaccine schedule that is kind of stretched out so children aren't getting more than one kind of well visit. And so that's really kind of compounded fears in a lot of parents that think that vaccines are, again, kind of overwhelming their children's immune system, and well, there's a doctor supporting it, so so something must be behind that. And then there are others who also don't necessarily have a biological background, but they're really good at kind of selling fear. And they have great nicknames like the Food Babe and the Health Ranger, and have very prominent websites that advocate against vaccinations and other types of kind of health scaremongering. So there are a lot of them out there, and some of them do unfortunately have some scientific or medical training, but they use that rather than to treat patients, they use that really to kind of make money for themselves.
Yeah, and I guess those last two that you mentioned, are they part of the mommy bloggers that you describe?
Those are not. Well, actually, the Food Babe just recently did have a child, so I guess she could perhaps be moved into that category. But yeah, there are some prominent, I call them mommy bloggers, that also discuss how their children are being raised without vaccines and being raised, organically, and their children are very pure. They don't, eat McDonald's. They don't eat any food with preservatives, these types of things. And, this idea of raising these kind of pure organic children often also leads to a rejection of vaccines, which they suggest are, filled with all of these dangerous chemicals.
Yeah, and the unfortunate thing is some of these blogs are incredibly popular.
Yes, definitely. They have a much bigger reach, unfortunately, than I do as a scientist.
Okay. Now, vaccine skeptics are not all the same. They differ significantly across a broad spectrum of belief. Can you talk about this, and why is it important for scientists to understand the difference?
Right. So there's not a one-size-fits-all as far as people that fear or reject vaccines. So it varies widely across the political spectrum. A lot of the people that kind of get attention nowadays are mostly kind of on the left, again, kind of motivated by that fear of chemicals and things like that, and kind of an environmental protection angle. But there are also people that are very right-wing, kind of libertarian idealists that don't want the government involved in their health care or the health care of their children. So it varies widely across the political spectrum and also across individuals' thoughts and beliefs about vaccines. So some are very adamant that they are never going to have a vaccine. Their children are never going to have a vaccine. They believe, all of the kind of fear-mongering about them. But a number of people just aren't convinced. They may be kind of on the fence. They may have heard some of those, accusations against vaccines, some of the ideas that they're not safe, but they don't really know maybe who to trust. They're just, skeptical, but not convinced one way or the other. Or new parents that are just starting to dive into this and starting to read about, do I get my child vaccinated or not, and are really genuinely looking for information. So you have a, entire spectrum of people, from those that are just, questioning and looking for information, to those that are completely convinced that, vaccines are an evil of big pharma and are, they're never going to be have their minds changed.
Yeah. Now, you say in the paper that scientists, those that understand the science behind vaccination, aren't always the best at changing the minds of those that reject vaccines. Where are we falling short?
Right. So, one of the things that scientists like to do is to educate people about this, right? And well, that's good, and I think that's definitely important, again, because you do have those people that are just looking to be educated about vaccines and to get the information. That's not always the best way to reach, these people across the spectrum. Some of them are very educated about vaccines. They're just educated from the wrong sources. So they're kind of adamantly miseducated or misinformed. So trying to tell them, trying to introduce the studies about vaccine safety or things like that may have been performed by doctors or by scientists or by, pharmaceutical companies that they inherently don't trust, is not going to help change their minds. So you really need to, approach this in a number of different ways, both from, the scientific aspect of educating people about vaccines, but also from kind of the emotional aspect or the personal aspect. I have 3 children myself, and they're, vaccinated for every possible thing. Mm-hmm. And the only side effects we've ever had have been, a little bit of redness at the injection site and, maybe a little bit of a fever or something. But, my oldest is 17 years old, and we've had lots of vaccines and never had any issues with them. Sure. And so, I feel that it's an issue of keeping my children safe, of helping to keep the community safe. So that's something that I have personally dealt with, and never had any issues with. So I think we need to get a little bit more personal and emotional and, understanding of the fears that people have, and not always be quite so scientific and clinical. And I think that tends to be our first, go-to as scientists, just to employ the logic, but we also need to add some of those personal feelings as well.
Yeah, and that will clearly make us better ambassadors. Dr. Smith, any final thoughts on this topic?
I think that's it. I mean, one of the things I also suggested is that, scientists sometimes are hesitant to advocate. They think it may, introduce bias or things like that. So if this is something that people aren't comfortable doing, maybe with friends or family or strangers, what have you, there are other ways to support vaccines kind of behind the scenes. To contact your legislatures if there are considering any bill on vaccination. Of course, California has had a recent kind of change in their vaccine requirements, requiring vaccines for students to go to school and taking out a lot of vaccine exemptions. If that's something they're comfortable advocating with behind the scenes rather than out in public, that may be something they can do also. Also if you work at a university, one of the things I'm kind of working on is trying to get our university to require more vaccines. Right now, we only require the MMR and nothing else, which is kind of, I think, lagging behind many of our peers. So there are a lot of different ways to work toward increasing vaccination rates in your community. And if you're uncomfortable with, having some of these conversations with individuals, there are other ways that you can still support that.
Okay, great. Some great advice, some great ideas. I want to thank you, Dr. Tara Smith, for your time and expertise.
Thank you for having me on. I appreciate it.
You bet.